Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Rebecca Sack. I am a board-certified allergist, an immunologist, and a fellowship director who always enjoys learning more about the exciting field of allergy immunology. Our podcast series will use interviews with thought leaders to keep up to date on new developments and to review core topics. Today's edition of our Conversations from the World of Allergy podcast series will focus on the topic of practice management and the business of medicine in light of the upcoming practice management workshop. We are pleased to welcome Dr. Anil Nanda. Dr. Nanda is in solo allergy immunology community practice in the Dallas area, and he is also a clinical associate professor of medicine in the Division of Allergy and Immunology in the University of Texas Southwestern Medical Center in Dallas. So he's the perfect person to talk to us about the business of medicine, understanding both the aspect from private practice as well as in academics. He's co-chairing the upcoming FAAAAI practice management course in Nashville, Tennessee. Dr. Nanda, thank you so much for taking your time to join us today.
Yeah, absolutely. And I go with first names. So Rebecca, hey, thank you so much. And you're an amazing podcast host and colleague. So I appreciate you having me on. Thank you.
Absolutely. We like to start by getting to know our guest a little bit. Can you tell us a little bit more about yourself and maybe include something you like outside of medicine?
Yeah, absolutely. I love being a physician, love being an allergist, immunologist. But I'm a big sports fan, big football fan. So, how I look at life sometimes, there's two seasons, right? There's football season and then waiting for football season. So right now we're in the waiting for football season phase. But I enjoy other sports, tennis, basketball, baseball, hockey. So I'm happy all year round because there's always some sports going on. So really excited. When I go to different conferences and go to different cities, vacations, I always like to go to, football games or any kind of sporting events, basketball games, baseball games if I can. So that's just a little bit about myself, and I do some medicine on the side, of course, right?
I feel like that's in Texas. I didn't understand the love of football until we were just talking about, I went to college there and amazed at what a big sport football is.
Yes, exactly. I mean, it's huge. And, yeah, absolutely. And I know, Rebecca, you're an Aggie A&M grad, so I think things are looking good for their football season, coming up this fall. So that's good.
We've had some rough years, so it's good to have a good season. So tell us why you think it's important to understand the business of medicine, particularly given the current climate.
Yeah, absolutely. The business of medicine, a lot of times it's not taught. I wasn't taught that much during medical school, residency, and a little bit during fellowship. So I think it's huge. And a lot of times, people, they, our fellows in training, right? Our future, they finish up their training and they're like, wait a second, I didn't know about this. I didn't know about, these prior authorizations. I didn't know about billing or reimbursements and things. So it's a very, very practical thing. And I think, I want to, commend the FAAAAI for doing it. Practice Management Committee, we'll talk about this a lot. But definitely our allergy immunology organizations are really helping us out. And it starts here. We're doing it here on this podcast. So it's something that's kind of, I wouldn't say undervalued. It's just not taught as much. And it's interesting, a lot of fellow programs, a lot of fellowship programs, it's a mix. Some have more private practice exposure than others. Some have more billing exposure than others. So I think it's very important to have everyone on the same page and get some introductions to the business side of medicine. Absolutely.
And when you first started in practice, particularly in the private practice, what do you wish you had known?
A lot. I think I wish I'd known more about the billing procedures, coming out of fellowship, and I was taught a little bit. I want to really give some credit to my attendings at National Jewish and University of Colorado, where I trained, in that they did teach some of the business side, and we had actually a program where one day in clinic we would have a full-time faculty attending, and then a physician from the community, an allergist, immunologist from the community who's on clinical faculty at University of Colorado National Jewish teach us, And so I got involved in that, got some knowledge about billing from that, and that was really helpful. And you mentioned, I'm at, University of Texas Southwestern Medical Center. We have the same program where, we have, myself as a community allergist and others, we volunteer and precept fellows and talk to them about billing and things. So I'm kind of paying it back. But not every program has that, so very fortunate about that. So I learned a little bit. I think more, I was very lucky. I joined a practice right out of fellowship, which was very supportive, excellent practice. Their office manager and billing managers really helped me understand the business of medicine. And I was there for about 3 years and decided to go on my own. And they were very supportive. That the practice where I was at was very supportive of me, going on my own and, really continue to help me. And, we're friends to this day, myself and the other physician, Elliot Kinchansky. So I think it's just been amazing. But I've been one of the lucky ones. A lot of, talking to a lot of colleagues, they've had no training about the business of medicine. They come out and they've had just tough experiences in their different practices. And so that's the whole point of this and the practice management workshop, absolutely, to help everyone out. So.
And how do you think academics versus private practice think about the business of medicine?
It's interesting. A few years ago when I was training, I'm not going to tell you the years when I was training, right, to date myself. But back in the day, when I was training, it was this kind of, separate kind of thing. Like academics is on one side, on one side here, and private practice is on the other side. And I see it really merging a lot. It's very interesting because one thing in academics, have revenue units or RVUs. And they're looking at it more, in this day and age right now. It's really affecting my academic colleagues a lot, and I think it's important to know about billing and which money comes in, how the expenditures are. It's really affecting my academic colleagues a lot also. So we're really in the same boat. I think we have so much more in common, as community physicians and the academic, colleagues and of course those colleagues in industry and government. But we're really all affected by it, and I think business affects, it affects academic institutions just as much, right, as private practice, community-based practice. So it's really merged, I think, really merging. So we're all working together now, which is great.
Is good. Yeah. I think we all have things to learn from each other, particularly.
Absolutely. And that's where the Quad AI comes in, I think, because I'm in community practice, but I've had so many great academic colleagues in industry, colleagues working for the government, and we're all working on committees, writing, papers together, manuscripts, work group reports. So, and we learn a lot, from each other. So I think it's amazing what the Academy is doing.
So what are some common questions that you hear about coding and billing that come up?
A lot of the questions, I'd say it's immunotherapy is a big one. The billing code 95165 for allergy serum, the allergy injections 95117, 95115, and also modifiers. You see a patient. We know a lot of us know about the different codings for for office visits, new patient visits, consultations. But then the adequate use of modifiers and the correct use of modifiers, like modifier 25, you see a patient, you do a testing or skin testing or pulmonary function testing, pheno testing. What are the correct modifiers to use? And I think those are some of the common questions. And again, our practice management workshop is really gonna help out with that and update on coding because it changes so many times, right? I mean, every year there's different coding updates, things like that. So.
Are there common pitfalls you've seen that mistakes people make?
I think one of the biggest things is, it's good to know the insurance carriers and things. So things like HMO plans, like you need a referral. I think that's one of the biggest pitfalls is patients come in and they're like, yes, I have this, this commercial insurance. It turns out to be an HMO, you need a referral, and you get paid zero. You do all this testing, you see the patient, and it's like amount paid $0.00, $0.00. You're like, wait a second, I did all this stuff. And so I think that's one of the common pitfalls is knowing when you need a referral, getting to know your community physicians. The primary care physicians who are referring you the patient and having a good relationship so they know to get in those referrals. That's a very common pitfall. The other one is not billing correctly, potentially like not using a modifier if you're doing allergy testing. So you get paid maybe for the office visit, but not for the allergy testing. That's another common one that I see. So really billing and coding is just so important. And I think as physicians, as allergists, immunologists, I think giving ourselves credit, like we spend a lot of time with patients, right? We're one of the few specialties that spend a lot of time with patients. And so I think, making sure that you're coding your office visits correctly, not undercoding, because you spend a lot of time with patients. We see a lot of complex patients. We address a lot of issues, a lot of medical issues. And so I think coding correctly with all the complex patients that we see. So.
How have you gotten to know the primary care physicians in your area? What have you felt has been helpful?
Yeah, I think what's been helpful, I'm pretty involved in my local county medical society. And so that's helpful. I go to my community hospitals where I'm affiliated with. I go to the medical staff meetings, go to the the lunches, like the physicians' lounges and things. I think that's a great way to meet colleagues. And any patients I see, I do it old-fashioned sometimes. I pick up the phone and call the primary care doctor. For example, if someone's on a beta blocker and I'm considering allergen immunotherapy or they have a high risk of anaphylaxis, I'm like, hey, can we look at some other options for the beta blockers, for their blood pressure, or whatever the case may be. So just, picking up the phone and calling. I know it sounds very old school, but calling the primary care physicians, talking with them. And every time I see a patient, I see, if they have a primary care physician, sending them an updated letter on follow-up with the patient. So I think that's a great way to market your practice, and also, to get to know the primary care physicians and providers, right? There's a lot of nurse practitioners in my community, physician assistants. So I know them because they're the ones who do referrals a lot of times, we're working under the physician. So I think it's just, we're all colleagues and it's great to work together.
And one of the things that we talk a lot about is clinical efficiency. I think all of us are feeling lots of patients to see, lots of things that we need to do in terms of notes and letters. Are there tips that you've been able to implement that have helped with your clinical efficiency or your workflow in the office?
I think so. I'm in solo practice, so I'm still working on it. There's a lot of my colleagues are using artificial intelligence or AI, to help out with the notes. So I'm looking into that. But I just try and be as efficient. I know my practice, well, my staff, works well with me. So I kind of know which patients may be a little more time consuming, maybe a little more complex than others potentially. And so I'm able to kind of work my schedule that way. And so I'm very fortunate, being in solo practice, I have total control over my schedule in the practice. So I'm able to, spend time with some patients, more, new patients get more time, follow-up patients get more time. And again, I'm in the minority here, but I don't have any entity that says I have to see this many patients or that many patients or I have this much time to see patients. So I'm able to do that on my own, which is, again, I'm in the minority here. But I think artificial intelligence is one thing that can help out. A good thing about it, right? We all know, sometimes there's some pitfalls and stuff with it, but things like scribes and note taking and things help out. But I just try and be as efficient as I can, and just have my notes. I tend to know a little bit about the patient before seeing them, like what they're in for. Is it allergic rhinitis? Is it for asthma? Is it for some skin issue? And then I could have, kind of templates on my notes. That's what I do, kind of note templates, so I can adjust as needed when discussing with the patient. So there's different things you can do in practice. And that's one of the topics, in practice management in our workshop, is trying to practice more efficiently and potentially using artificial intelligence to kind of help out. But really just efficient staff flow, efficient practice, practices, I guess, to kind of help things out, definitely.
They've been piloting AI note writing here at
Sure.
MGA. There's some really good things about it. It's actually better than I thought it would be.
Sure.
But it doesn't talk in your voice. And so you have to get used to either the first couple of weeks, I just rewrote everything. And then I thought, well, this isn't increasing my efficiency at all. But getting used to, as long as I've gone through and made sure the information is accurate, being willing to let go a little bit of this, of it not being in my tone, has helped. But it is hard.
And exactly. And it's like, I think it's almost like EHR, right? Electronic health record. There's pluses and minuses. There's no perfect, AI system. There's no perfect scribe. There's no perfect EHR, right? There's pluses and minuses. So how I look at it, Rebecca, is, I lean into the positives, look at the positives and try and improve the negatives. And I think it's great. I think we share a common, right? We're writing notes and things, and I'm in solo practice. I affectionately call my practice a small mom and pop, practice as myself a medical assistant. And you're at Harvard, MGH, right? Mass General, and we're dealing with the same thing. So it just shows how how common things are between, our academic colleagues and community practice. Absolutely. So.
And are there regulatory issues you've seen come up more recently in practice that are new or have changed?
Yeah, there are always some Medicare issues, like government health care and things, and even policy issues with the commercial payers that come up. And I really credit again the advocacy, the Quad-A advocacy, and the Quad-AI for keeping us involved, keeping us up to date on all of those issues. And again, that's one of the topics at the practice management session workshop in Nashville is going to be regulatory issues affecting your practice. Me being in solo practice, I'm able to kind of quote unquote stay under the radar a little bit, but I'm able to at least learn through the Quad-A about what the regulatory issues are. I have a billing company. That's one thing, potentially that helps out my efficiency. I have a billing service that takes care of all my billing. So they're also involved in keeping up to date and making sure I'm I'm keeping up to date and abiding by all the regulatory rules and things. So that's very helpful, kind of that outsourcing that a little bit.
If being in private practice, is there a billing and compliance review that the billing company does?
I believe so. I think they're supposed to do it about once a year. And I trust that my billing company does do that. But I haven't, knock on wood, I haven't had any issues or any problems from the insurance companies. The main thing with payers and things is that, if something's not documented correctly, or, the thing that a lot of us in practice are seeing are just claim denials, and especially with allergen immunotherapy, the serum, the 95165, is automatic denials and sending records and things. And so that's probably the most common thing I think that we're seeing. And again, I appreciate the Quad-AI helping out and really helping us out with trying to resolve that, again, with advocacy and talking and really leading the conversation with the insurance payers to help reduce that, including pre-authorization burden. So I appreciate them reducing the potential burdens we have and continuing to work on it. So.
Absolutely. Well, we've been talking a lot about the upcoming practice management workshop.
Sure.
Can you tell us a little bit about when and where it is and who you think would really be the target audience?
Yeah, absolutely. It's in Nashville, Tennessee. So rockin' Nashville, right? So I'm gonna bring my cowboy hat and we're gonna go two-stepping and line dancing at night. So it'll be a lot of fun. It's July, so it's just next month, Friday, July 18th, Saturday, July 19th, and Sunday, July 20th. So through the weekend. And it starts in the afternoon. So I think it's great in that, it's an afternoon Friday. So, you can go to work, see your patients during the week, and then come out on the weekend and really help improve your practice. And I think it's for everybody. The way I look at it, and we talked about it right at the onset, right? This kind of, academic and private practice. We have some sessions, particularly for the academic allergists and dealing with RVUs and it's called practice pressure points, the employed and academic allergists, things to optimizing your relative value units and managing institutional expectations. Of course, billing and coding, there's sessions for everybody, right? That's for all the allergists and the practice manager and staff. I think it's so important. There's things like, helping your staff, get more efficient, choosing staff, interviewing staff, things on the independent allergist, solo allergist. And I think it's great. I want to, give a shout out to, my co-chair, Vivian Hernandez Trujillo, just a great leader. She's chair of the practice management committee. All our planning committee members involved, Lori Sweetman, Quad-AI staff who's involved, and in particular, a couple of, former practice management chairs who are faculty, Mohammed Yassin and Priya Bansal, who have graciously offered to sponsor some of the fellows in training to come out there. So we're really excited about that, and I think, as we said, there's so much that's not taught in fellowships about billing and coding. And so we're really excited to have some fellows in training come out and allergists of all, again, academic medicine, community practice, all ages, all different points of career, because billing coding changes every year, right? There's always updates every year, so it's important to kind of keep up to date with that. So definitely, we're really excited about it.
It sounds like not only people from all stages of their career, people from all over the country who've been involved in the business side.
Absolutely, because it affects all of us, right? I mean, I know there's some state issues, and different commercial payers have different things, Medicaid and things in different states, but we're all unified. We're all unified nationally, and there's so much going on nationally in healthcare that it really affects all of us. So I think it starts in Nashville, kind of learning about things, coming together, and helping us all become better physicians. Absolutely.
So if you were someone who was looking to either change practices, change jobs, or maybe a fellow looking for their first job, is there advice that you would give in terms of what to look for when you're looking for a job, what questions you should ask?
Absolutely, Rebecca. I think the first thing is it's nice to talk on the phone and things, and that's great. But really going and visiting the practice or institution, right? If you're going to academics or farm, if you're going into industry or government, visiting the place of work, visiting the practice, meeting the staff, because I think culture is so important. We mentioned at the onset, I'm a big sports fan, right? And they say, how the locker room culture is, right, in sports, and how the team kind of comes together. Exact same thing, kind of the same parallel, when you're looking at different practices and things, how the culture is, if the staff are happy, how well the staff are treated, how well the physicians are treated. And I think the other practical thing, in addition to culture, is actually hiring a healthcare attorney just to review the contract. I think that's important because I know, a lot of times we've all heard these horror stories about, people going and they interview and everything sounds great and they're told what they want to hear and and then they go to the practice and they're like, wait a second, this is this fine line in this contract and this wasn't the way it was supposed to be, and it's an issue. And I think it's about 80% of and this is just physicians in general, just last about 2 years in their initial practice out of training. It's about, and so 80% leave after 2 years for whatever reason. There's a variety of reasons. And I think one of them is not looking at the contract carefully. So I think having an attorney look over the contract, because, as physicians, it's interesting. I know we all have egos, right? Myself included. And we're like, hey, I've trained in all this stuff and I know allergy immunology well. So, a contract will be pretty easy. But, there's a lot of legal jargon that we're just not trained at as physicians, right? And so I think it's important to look over the contract with an attorney and really look at the culture of, and also I think practices, should be pretty open about the finances. I think a lot of times it's kind of this hush-hush, people don't talk about the finances and they're like, oh, don't worry, the finances are fine. But I think it's nice to actually look at the finances if possible. And I think the more transparent a practice is about the finances, I think that's a green flag. That's actually a good sign. So get as much information about the practice. And the other thing about joining a practice is talking to the allergists in the community, right? I think, we're all a very collegial group, and that's one thing I love about our specialty. We're all very collegial and all work together. And, just talking with different allergists in the area about, hey, what's the reputation of the practice? And what do you think about the practice? Do they practice, good medicine, good medical care? I think those are things to look at. And I, tell my fellows in training, that I teach to kind of look out for that too. And that's going to be involved. Again, another session at the practice management workshop on interviewing skills and what to look for when joining a practice or institution. So.
Yeah, that's great advice. I think the culture is so important. It's what you keep
absolutely.
in place. If you really don't feel comfortable or if this isn't a group that you work well with, there's no way that you're going to be able to take good care of patients.
Yeah, absolutely. Absolutely.
Yeah, and I like the idea of asking about the finances. I think because in medicine, we so often focus on, well, as long as we're taking good care of patients, we don't need to worry about that. And it is such an important part of our job that we don't necessarily learn about in fellowship.
Yeah, absolutely. Absolutely.
And then are there topics that you think fellowship programs should do a better job of incorporating that would help fellows be more successful as they go out?
Yeah, I think billing. I mean, I think there should be, and just like at UT Southwestern, what I had at National Jewish University of Colorado, and there are fellowship programs that do this, but I think a great partnership, between the the institution, the university, the fellow training program, and the community-ologists. I think that's really vital, and I think it's great. And again, it's a lot of us in community practice, we like the academic side, we like the teaching side, and we like being mentors to the fellows in training. So I think that's very important. And then having just maybe a session. There's always these noon conferences, and it's great. A noon conference on mast cell disease and food allergy and urticaria. But have a noon conference on billing. Invite one of the community-ologists maybe in on faculty or just in the community to give a noon conference or a conference, whatever it is in the morning, things, whatever the conferences are on billing and coding, what it's like to be a private practice, what to look for in private practice, or even someone in industry. If someone's in industry, have them come in and say, hey, as a physician in industry, what to look for when you're working for industry, when you're working for government. So I think that's very, very important. Just incorporating that as part of the the fellowship curriculum, I think is great. So, and they're already doing that. I'm gonna commend all the fellowships and and FAAAAI incorporating that, and the fellowships incorporating that already, and looking at the business and private practice side of medicine.
And the other thing we don't necessarily always consider is the idea of being an employer in practice. How has being an employer been challenging for you?
Yeah, it has. I've been very fortunate. I've been very blessed. I have some great staff members, and they've been with me for a while. And I think it's the culture. I think it comes back to culture. You want to create it's from top down kind of thing, right? So it's, I'm the owner of the practice, in my small world, my small mom and pop bubble here, but I'm the owner of the practice. And so, I think treating staff very well as part of the teamwork, the culture, saying thank you and really, really being there for them. We all have, families and friends and issues, pets and all that. And so we have issues to kind of take care of. And so, I think that's important. If a staff member has to go pick up their kids one day from school or leave early, or there's an early school release, or their child's sick or mother's sick or father, whatever it is, just having the grace to kind of do that and understand that, I think that really helps as an employer. So I think the culture is so important. And, I think just being very, I think, understanding of that, and not try to cut corners, so to speak, on different things. Because it's a stuff, it takes time to train staff members, right? And, I think, just creating a very positive culture, and then staff members will stay, I think. But that's been, I think, my advice is just kind of, do that, from the culture. And it's difficult. A lot of my colleagues, they don't have a say. Sometimes, they're employed, right? Employed allergists or in an academic institution, and they don't have much say over that. But what you can control is your own positive outlook, If you have a positive outlook, try and build a good culture in your clinic, wherever it is, academic, or if you're in industry, or if you're in, private practice. I think that's very, very helpful and really, really relates to great staff retention. And again, that's going to be talked about in the practice management workshop. So you kind of see how it affects everybody, right? No matter what your practice situation, academic, community, et cetera. So absolutely.
Yeah, no, just like you were talking about when you're looking at a practice, looking at the culture, when you're hiring, creating a culture where people know each other's names, your kids, know their kids. I think it makes such a difference in how we treat each other and in people wanting to stay and do the best job they can.
Yeah, and understanding, right? There's a lot of stresses going on right now, right? There's a lot of adversities in the country and in the world, and we're all affected by that. So I think trying to keep positive and understanding when people are stressed and things, and try and keep as good a culture as you can in your own little bubble, where you're at, and it really makes a big difference. And it's not like, it's just for staff. Patients see that too. They see the culture, and patients, it leads to higher patient satisfaction. So that there's some, great advantages to that also. Some tangible benefits, definitely. Tangible benefits.
Have you had to deal with difficult patients, and do you have any tips in dealing with the more challenging patients, not necessarily medically challenging, but challenging in other ways?
Sure. No, absolutely. And I think, I'm I'm a challenging patient myself. When I see physicians, right, as physicians and healthcare professionals, we're not the greatest patients ourselves. So I try and, I think talking, I think as allergist immunologists, we tend to spend more time with patients. So maybe, spending a couple of minutes extra with patients, and if patients unsatisfied or has a lot of questions and issues, just trying to spend just a couple of minutes, that really helps, because, from the patient experience, and we've all been patients, we all see our physicians and things, it's just, you can tell the difference, when some physician is very, short or doesn't really take the time. Even that 1 or 2 minutes makes a big difference, because when patients go see, sometimes, other physicians, and much respect to all of our colleagues, all the other specialties, but sometimes, they're not really, not a lot of time is spent, and patients tell me sometimes they feel like they're just a cog in a wheel, they're just a number kind of thing. And so just spending a little extra time with the patients, especially maybe some of the more challenging patients, really makes a difference. I don't have all the answers, right? We're not perfect physicians. I may not have an answer to their dermatitis, but just the fact that I'm listening to the patients, spending a little extra time with them, really makes a difference, and they're really more satisfied. And again, there's tangible benefits. It leads them to, if they have asthma or whatever, it leads them to take their inhaler, as directed, as, corrected. And it leads to better adherence, I think. So it's tangible benefits also to help people out, definitely.
And one last question. Do you have ways that you educate patients that you find helpful in a busy practice environment? Do you have videos or handouts or using staff in order to help with just kind of the movement of patients through the clinic?
Absolutely. I think handouts are very important. But what I found, Rebecca, is, patients really value the time with their professional, with their physician. So my staff is great, and they're really helpful in explaining things, but I try and explain most things myself in addition to my staff, and that's where the 1 or 2 minutes kind of come in, is, let's go over your inhaler technique. Let's go over the medications. Let's go over the difference between, topical steroids and moisturizers, for your atopic dermatitis. So I think just that extra time, personal, with the physician in the office, to me, in my experience, that has really helped me a lot, and patients have really appreciated that. One thing also that I found helpful, and just a little tip, is, we're all running behind. We're seeing patients, and some patients take longer than others, as you know. And if my clinic's kind of backed up, sometimes I personally go in the waiting room and say, hey, I'm Dr. Nanda. I really apologize, but, I'm running a little bit behind. Just give us a few more minutes, just have some patience. And, pun intended, I guess, right? The patients they're really impressed by that. And they're like, hey, the doctor came out and explained the situation. So if they're upset, it kind of helps mitigate that a little bit. So that's just a tip I've found, just talking to the patients personally. So.
Yeah, no, I find that especially on a day where maybe there was a reaction during a food challenge and that's taken up a lot of my time, and I'm now 45 minutes behind, just going in, acknowledging that I've kept them waiting, apologizing for that, explaining that, there was a complicated patient and that I hope now I can direct my attention to them, does seem to really help when people are frustrated because they've waited already for the appointment and now they're waiting to see you.
They're stressed and stuff, and they're sick, right? We take care of sick patients. So, it's a tough situation, but I think that helps out so much. And just, I think, showing grace, like, I've been late to clinic sometimes, right? Family matters, things like that. And when patients are late sometimes, I think just giving them some grace. I have patients say, hey, I apologize. Like, well, I totally understand. I was late to clinic one day. So just kind of the human aspect, with all this talk about AI and artificial intelligence and this and that and computers and blah, 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 internet, all that, the human connection is still very important and very valuable as I go through life, basically.
Absolutely. Well, I just want to remind people that the Practice Management Workshop is in Nashville, Tennessee, July 18th through the 20th. Registration is open, and this is just kind of a taste of all the things that you can learn in how to make the business of medicine better and how to improve efficiency and billing and practice. So thank you so much for being involved in that.
Yeah, no, appreciate it. And I just want to thank everyone, all the physicians and patients and professionals, everyone hearing this, I just want to thank you for taking care of patients. I know it's it's trying times and a lot of adversities out there. So I just want to thank you for taking care of all of our patients around the country and around the world. And, I really appreciate, the FAAAAI, what they've done to support all of us, all of its members. And it all starts in Nashville, and I hope to see a lot of you there and all of you there. And it'll be a great session. So appreciate it so much.
It sounds like they should bring their cowboy hats and the boots so that way they can go
out.
Yeah,
absolutely. Absolutely. We're all going out. Yeah, we're all going to go out. It'll be a lot of fun. So it'll be great.
Perfect. Great. Well, any other take-home points you want to share before we sign off?
No, I think we covered everything. Again, thank you to everyone. And again, thanks to you, Rebecca, and Laura, and thank the FAAAAI. Appreciate it so much.
Thank you. We hope you enjoyed listening to today's episode. As a reminder, this podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence-based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find Allergist search engine on the Academy website is a useful tool to locate a listing of board-certified allergists in your area. Use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at their website. Please take a minute to visit thequaai.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to rate and subscribe wherever you download your podcast. Thank you again for listening.